Thank you for tuning in to our LTISD Mental Health Parent Series. In this session, we will talk about the hard topics of suicide and self-harm. You will learn how to recognize the warning signs and ways that you can best support and help your child deal with these difficult issues. First, I'd like to introduce our social work team who will be providing our content throughout this series. We have 5 social workers in Lake Travis ISD, and all are licensed mental health professionals with many years of education, experience, and training in working with youth, children, and families. We have Daniela McFarland, who serves the Hudson Bend Middle School feeder pattern, Lacey Branker and Rachel McComber, who both serve at the high school, Tracy Barney, who provides social work services for our BCMS feeder pattern, and Colette Sween, who provides LTMS with social work services. I'm Jennifer Lyon. I'm the Director of Health and Social Emotional Learning, and I will be your narrator for this parenting series episode this evening. If at any time throughout the school year you or your child are feeling stressed or worried or having mental health issues, please reach out to one of our social workers on the previous slide or to one of the school counselors that you see listed here or the counselor that you know at your campus, at your child's campus. Today, we're going to discuss 2 difficult topics that rightfully will bring up a lot of fears. I want you to feel free to pause or stop this video if at any time the content is too difficult for you and you need to take a break. But my hope is that by the end of this series, some of that fear will be replaced by knowledge, and with knowledge that you will feel more comfortable and prepared to handle any mental health crisis that might come up in your own family. Our objectives will be to learn about the prevalence of teen suicide and understand some relevant statistics. We're going to explore the risk factors and warning signs that might contribute to teen suicide. And we're going to look at some protective factors that are important in mitigating the risk that teens might to help teens so that they're not going to be considering suicide. Finally, we're going to end talking about prevention and how to get help if you have a teen in need. First, let's start with some scary statistics. In the past 10 years, suicide rates among young people ages 10 to 17 have increased by more than 70%. Suicide is the second leading cause of death in the United States among kids age 15 to 24. Gun violence, or gun injury is the number 1 cause of death, and drug overdose is number 3. So every day in the United States, we have about 3,000 suicide attempts by high school students nationwide. And it's estimated that about 20% of all high school students have considered suicide, with about up to 9% actually making an attempt. These are scary, scary numbers for both parents and educators. Rates of suicide in youth are twice as high in Black teens as compared to their white peers. And the suicide rate has increased over 60% in the past 2 decades. We know that these certain groups that we are listed here on this slide have significantly more risk of suicide than their white peers. Also, our LGBTQ plus teens are 4 times more likely to attempt suicide than their peers. We have seen teens admitted to the Children's Hospital as a result of suicidal ideation. We also sometimes call this SI, suicidal ideation, or self-harm. We've seen this more than double in the last decade, and it's increased even more during the pandemic when we've had school closures and lockdowns. And this was probably due to the fact that teens lost their social support networks, and some lost their stress outlets such as sports or activities. In addition to all these scary statistics, our communities are facing a severe shortage of mental health providers and adolescent psychiatrists, which adds to the crisis. Texas is 49th in the nation for the number of mental health providers we have as compared to those who need help. Some other higher risk groups are females. Females attempt suicide more than three times more often than their male counterparts. However, males die by suicide more often than females because they use more lethal means. We also have some cultural variation that exists among suicide rates in our teens. Like I mentioned on the page previously, with some of our LGBTQ plus, they're just at higher risk than some of our other youth. Let's talk about some risk factors. Suicide does not typically have a sudden onset. There are usually a number of stressors that can contribute to youth's anxiety and unhappiness that increase the possibility of a suicide attempt. One of the most telling risk factors for youth is mental illness, with depression being the most common. Additional mental health conditions that can affect your teen are bipolar disorder, schizophrenia, conduct disorder, and we also have seen a huge increase in anxiety disorders in the last several years. Also, substance use such as alcohol and drugs are associated with 50 to 67% of suicides because it changes their inhibitory factors and can make them do things that they might not otherwise do if they were not under the influence. A scary statistic is that most kids and people suffering from mental health issues deal with the problem for almost 8 years before getting adequate treatment. We would like to change that. Some other issues that can be risk factors for our children include physical health conditions that teens might have to deal with, such as Crohn's disease, type 1 diabetes, or traumatic brain injury, sometimes also autoimmune diseases. These can all affect a teen's mental health and thus lead to suicidal feelings if they are not treated. Additionally, there are environmental factors such as access to lethal means, including firearms and drugs. Prolonged stress, such as harassment or bullying, relationship problems, or poverty. Stressful life events that kids deal with their families, like rejection, or parents going through a divorce or a financial crisis, or other life transition or loss and grief. Exposure to another person's suicide can be a risk factor as well, or to consuming or watching graphic or sensationalized accounts of suicide on any kind of media. Finally, the biggest risk factor in a teen's ability to complete suicide is access to the means to do it. So, access to a firearm, access to medication, or a knife. The most popular medication to overdose on is Tylenol and usually antidepressants. Tylenol is acetaminophen and it can be very lethal and cause liver damage pretty quickly. So if your child has a history of depression, anxiety, or previous suicide attempts, or they're dealing with extremely stressful events, please be prudent and remove access to these potentially lethal means in your household. Most youth who die by suicide show some warning signs or behavior changes. It's important to note that not all youth who are at risk of suicide will show these warning signs, and that not all youth who exhibit these behaviors are at risk for suicide. Common warning signs include, but are not limited to, talking about killing oneself, feeling hopeless, feeling like a burden, or having no reason to live. Mood changes, including depression, anxiety, or agitation. Behavior changes, such as increased substance abuse, withdrawing from activities, isolating from family and friends, sleeping too much or not enough, giving away prized possessions, and irritability. You might also notice changes in appearance, such as not caring how you look or changing your style of dress or even changing friends. So we've talked a lot about all the scary things, but let's talk about protective factors. These can help your children, and these are things we want for all kids. And most important of all of these is helping kids feel connected and safe to talk to someone about their mental health. That person could be you, their parent. It could be an aunt, an uncle, a school counselor, a mental health provider. It could be anyone who can listen without judgment and help them develop a safety plan or a treatment plan for how they're going to get help. Again, also making sure that if your child is feeling depressed or suicidal, that you remove all access to lethal means in your home. Prevention. It can be prevented. Suicide can be prevented. You are not powerless. You can guard your teen against the possibility of suicide. Interact with your teen positively. Give consistent feedback, compliments for good work. Increase his or her involvement in positive activities. Promote involvement in clubs or sports or church or family. Appropriately monitor your teen's whereabouts and communications, especially with texting and social media. The goal of this is to promote safety. Be aware of your teen's social environment. Know who their friends are and their teammates, their coaches. Communicate regularly with other parents in your community. Communicate regularly with your teen's teachers to ensure safety at school. Limit your teen's access to alcohol, prescription pills, illegal drugs, knives, or guns. Talk with your teen about your concerns. Ask him or her directly about suicidal thoughts. We'll talk about that more in just a moment. Explain the value of therapy and medication to manage symptoms, and address your concerns with other adults in your child's life, such as coaches or other family members. Seek out help from your child's pediatrician. They are trained and ready to deal with these issues. Talking to your teen is so important, but sometimes it feels really scary to even bring up this subject. So here are some positive communication tips you can try. Talk in a calm and non-accusatory manner. Practice first if you need to get your tone of voice just right. Express loving concern because that is truly what you're feeling. Don't express fear or anger. Express loving concern. Convey how important your child is to you. Focus on your concern for your teen's well-being and their health. Make I statements to convey that you understand the stressors that he or she may be experiencing, such as, I hear that you're really stressed about these things that are going on in your life, and I am here to support you. Encourage professional help-seeking behaviors like locating appropriate resources. I will have some for you in a few slides. Reassure your adolescent that seeking help can change his or her outlook. Remember as a parent these words: the calmer I am, the more effective I will be. Teens and kids soak up our emotions like sponges. So when we are calm, they will be calm. Also remember that teens are self-searching, not selfish. Teens aren't giving me a hard time, they're having a hard time. Think, I don't have to fix it, I just have to listen. And remember, you and your teen are on the same team. You're in this together. Ask open-ended questions and avoid criticizing them. Just listen. If your teen reveals something to you when you're talking to them, seek help. Stay calm. Don't freak out. Don't say, oh no, you don't want to kill yourself. You would never want to do that. Just listen and validate their feelings. Take action. If you feel that something is just not right, or if you notice warning signs, or if you've noticed that your child has a lot of risk factors and very few protective factors, talk to your child about it. Ask them how they're feeling, and then find support and help in the community. Find a mental health professional. A great place to start is to look on Psychology Today. Go to Google, put in Psychology Today, find a therapist, and then put in your zip code. You can sort in lots of different ways to find exactly the therapist you need. Participate actively in your child's therapy. Be a partner with the therapist. If your child is in immediate danger, please call 911 for medical assistance, or you can call 988 for mental health assistance, or you can take your child directly to Dell Children's ER. If your child is actively attempting suicide, that is a medical emergency and you need to seek help immediately. Please remember that talking about suicide does not put the idea in their head. There's been much research done on this, but instead, it is usually a relief to them. It lets them know that you are open to talking about suicide and allows them to be open about it as well. Use the word suicide because that establishes that you are talking about the same thing. Remember to approach this topic with curiosity and compassion as opposed to judgment and fear. then reach out to professionals when you need further support and information. We're going to shift moments now and talk about self-harm. Just take a moment to take a deep breath, because we know that this is a hard and uncomfortable topic, all the things that we're talking about in this series. But we're gonna talk about it and give you some information that you need. Self-harm is a complicated topic, but I hope by the end of this presentation that you will feel a little bit less uncomfortable and a little more empowered about how to handle it if you have a teen who self-harms. Our objectives will be to understand and define self-harm, which can also be known as NSSI or non-suicidal self-injury. To understand the prevalence, we're going to learn about that, to learn more about the common forms of self-harm and the warning signs, and to look at the reasons that some teens self-harm and the best treatments for them. We're going to first start with a short quiz and talk about maybe some of the myths and misconceptions about self-harm. This quiz is taken from a workbook for teens who self-injure by Lawrence Shapiro. The first question: only a few very sick people self-injure. That is false. Many teens and tweens self-injure, and we will learn more about that in a moment. Number 2, teens who hurt themselves are trying to commit suicide, but they don't have the nerve. That is also false. Most teens who self-harm are not trying to kill themselves. Number 3, there are many people who self-injure. That is true. Number 4, teens who self-injure are just trying to get attention from their parents. That is false, but it could be a cry for help. And when kids cry for help, we need to pay attention. Number 5, self-inflicted wounds are a way of being accepted at school. That is actually both true and false. It can be socially acceptable among some peer groups. Number 6, only teens who have other serious psychological problems will harm themselves. That is false, but most do have some other comorbidities or other medical conditions, such as anxiety or depression. Number 7, if your wounds are superficial, your self-injury may just be a phase. That is also false. And number 8, girls and boys typically self-injure in different ways. That is true. So what is NSSI? There's lots of different terms for it. Non-suicidal self-injury. Most often you'll hear it referred to as cutting, but it can include a lot more than that. It can be self-abuse, self-injury, self-injurious behavior, self-mutilation, sometimes in the form of burning or other things. And a new one we've seen lately is self-trolling, which is self-bullying via social media. So how common is this? It's estimated that as many as 40% of adolescents have self-harmed, with the average age of onset being 12 to 14. So that puts our middle schoolers at biggest risk for starting self-harm. Within this group of self-harmers, up to 80% have reported attempting suicide, with 14 to 20% being completed. Those stats are really frightening. We even see some self-injury in young children. It can look like head banging, self-biting, scratching with fingernails or objects, pulling their hair, punching themselves or the wall, picking their skin, or not letting a wound heal. When children are pre-verbal in the toddler years, we see these behaviors as somewhat developmentally normal, as they usually stem from frustration or just being emotionally dysregulated, and they don't have the words to express how they feel. These behaviors can also be common in children with ASD or autism spectrum disorder. Some of the most common forms of self-injury with our teens and tweens, and what we see most often in schools, include cutting with razor blades, knives, or sharp objects, perforating or puncturing the skin with pointed objects such as pins, knives, a scissor tip, even a staple. We also see biting, burning, pinching, scraping, excessive rubbing or scratching of the skin. This usually occurs on the arms and inner thighs, sometimes on the waist or the bra band where it can be easily concealed with clothing. Some other lesser seen examples that are seen more often in boys are punching objects until their knuckles bleed, or punching or hitting themselves, or banging their head against like a brick wall or a hard wall. Some other common forms of NSSI are irritating wounds to prevent them from healing, carving words or symbols into your flesh with a knife or a piece of glass, pulling out hair with the intent to self-injure. There is another disorder of hair pulling called trichotillomania, but that is more an obsessive compulsive disorder, not intended to be a self-injurious disorder. And sometimes we will see kids swallow objects or substances with the intent to make themselves sick, such as the silica packets that you see in medications or shoe boxes. So, what are some of the dangers of self harm? Luckily, most NSSI does not lead to serious or life threatening injuries, but while self injury is rarely lethal, it can lead to other dangers such as infection, permanent scarring, accidental death, or even an addiction to the behavior. Excuse me. Often, just participating in self harm puts the child at a much greater risk for attempting suicide in the future. So, what do you look for if you're worried about your child harming themselves? The most obvious thing to look for, that I look for, is a teen who wears very baggy or long sleeve clothing, even when the weather is warm. You might also see bracelets all the way up the arm if a girl is trying to hide cut marks on her wrists or forearms. If you have a teen who will not take off their hoodie or won't wear shorts, and you suspect they may be self harming, it's time for you to do a body scan. Of course, any unexplained injuries or scars should be medically evaluated. Most teens who self-harm carry with them a little bag, like a pencil bag or a makeup bag, or a little kit filled with their self-harming tools. So if you suspect self-harm or see unexplained injuries, a room sweep, a backpack inspection, check their purse for things such as thumbtacks, staples, the blade from a razor or a pencil sharpener, or other little pieces of broken glass or other things that you are concerned that they may be using to harm themselves. Self-harm also typically includes very ritualistic behaviors, such as harming in the same place or using the same tools. If you have a teen who is withdrawing and isolating and spending a large amount of time in their room, you might be worried that they're self-harming. Sometimes kids will claim to be accident prone or wear different kinds of accessories like the bracelet or different necklaces or different kinds of jewelry to cover up their injuries. Some kids will also wear fingerless gloves or say that they have cat scratches to cover up cut marks. To understand why teens self-harm, we have to understand what inflicting pain does to our brain and body. I'm sure we can all relate to a time when, like the song says, it hurts so good. Such as when you are firmly massaging an aching muscle, or scratching an itch, or diving into a cold pool or a lake on a really hot day, or taking a whirlpool bath in hot water, or even vomiting when you're feeling nauseated. For teens, popping a pimple, or exercising even though your muscles are burning, plucking or waxing your eyebrows, or eating super hot and spicy foods, which sometimes can even be an addiction as well. For a teen or tween who is self-harming, inflicting pain has the same effect. It brings them a sense of relief from the pain, most likely mental or emotional pain, and releases a feel-good hormone called dopamine. That's the same as like a runner's high might feel. So why are these kids self-harming? Here are some quotes from teens and tweens who engage in self-harm when asked, "Why do you do it?" One said, "I hurt myself because it's the one thing in my life I can control." Or, "I hurt myself because it's exactly the kind of thing that would hurt my parents the most." "I hurt myself because I deserve to be punished." "I hurt myself because it is better than thinking about all the bad memories that I have." I hurt myself because it makes me feel things that I can't put into words. I hurt myself because it keeps me from feeling numb and dead inside. What I hear most at school is, I hurt myself because it helps me release my anxiety. Or when I feel overwhelmed, self-harming helps to calm me down. So let's dive a bit deeper into the feelings that a teen is trying to manage by self-harming. Are they trying to relieve anxiety, stress, or depression and don't have healthy coping tools? Are they trying to feel something when they feel numb? This can be common in a trauma survivor who has pushed all their feelings under the surface so that they can function. And so they're trying to feel something because they've worked so hard at numbing themselves. They may self-harm to feel a sense of control over a chaotic situation, such as a dysfunctional home life or abuse or neglect. They may also self-harm as a form of self-punishment for not being good enough or not knowing how to handle their emotions or social situations effectively. As mentioned earlier, self-harm releases the feel-good endorphin called dopamine, which actually reduces the amount of pain that the teen feels when they self-injure. Many say they can feel a rush or a high from the act. The worrisome thing about this is that it becomes addictive and can be used to escape the anxiety and depression related to trauma, interpersonal difficulties, or mental health concerns. For many students who start self-harming, it becomes a very addictive behavior, and it can be really hard for them to stop because of this dopamine rush that they're getting. So let's focus on some positive outcomes and what you can actually do to help someone who is self-harming. Let's talk about treatments. Parents often ask, what is the most effective treatment? Well, the most important thing for a teen who is self-harming is that they need a positive, connected, therapeutic relationship with a therapist. The relationship is what is going to heal the behaviors. A relationship that the teen trusts with the person that they feel connected enough to learn better coping skills and to do the hard work that they may need to do. This can look like cognitive behavioral therapy to help them identify unhealthy negative thoughts that lead to their behaviors, dialectical behavior therapy to teach them behavioral skills to tolerate and manage their emotions, psychotherapy to identify past experiences or issues that may be at the root of these behaviors. Sometimes you need family therapy to assist all the family members to support the individual and address some difficult family dynamics. And then at times, group therapy is also helpful to connect individuals who are in various states of support with a healthy network. Another thing that's helpful is learning mindfulness, because so often the self-harm is used as an escape. Mindfulness and being present in the moment can help them appropriately perceive their thoughts and actions and help reduce anxiety. So a lot of what therapists who deal with self-harm do with the teen is to look at what are the triggers or the things that spark the distress in them and their felt need to self-harm. And then they help the teen replace the act of cutting or harming themselves with more appropriate coping skills. So we're going to look at a few of these. These are tools that the teen would need to be able to use in the moment of distress to be able to manage their discomfort. So before they self-harm, most teens go into a dissociative state or they kind of zone out. That's why mindfulness can be so important in teaching them. So zoning out contributes to why they report feeling very little pain along with the endorphins. So the teen needs help learning how to stay present in the moment and be mindful of how they're feeling and what they're thinking so they can remain in control of how they manage their distress. So in this example on this slide, the teen is triggered and feels numb and is craving sensation. So the alternative coping skills will focus on the senses, feeling, smelling, and breathing to help bring them back into awareness and hopefully lessen their distress. So an example might be, I hear my parents fighting. I get overwhelmed, I shut down, and I have thoughts about cutting my arms. So instead, I use my coping skills and tools, and I get some ice, and I put it on my wrist, and I take deep breaths, and I tell myself, I am okay. I can handle this. Our next example is based on triggers of sadness, depression, or feeling unhappy. So it could be, I have a fight with my friends and I think everybody hates me. I feel alone and I'm sad and overwhelmed. I start thinking about cutting my thigh, but instead, I take a deep breath. I use my coping skills and I make a hot bath with lavender bubbles, and then I watch funny videos on YouTube until I feel better. And in this last example, my triggers of anger, frustration, or restlessness may be caused because I get a bad grade on my math test and I feel angry and upset at myself. I feel like a failure. I want to cut myself as a punishment, but instead I use my coping skills and I punch my pillow and I rip up an old magazine and then I put on a workout video and exercise until I feel calm. And then I pet my dog and tell myself, I'm okay. I can study harder next time. No one is perfect. And I do this until I am regulated. I love this quote. Loving yourself does not mean being self-absorbed or narcissistic or disregarding others. Rather, it means welcoming yourself as the most honored guest in your own heart, a guest worthy of respect, a lovable companion. This is the feeling we want for all of our children, no matter what they are dealing with. We know that suicide and self-harm are heavy and scary topics for parents. But our hope is that you feel more knowledgeable and empowered in dealing with suicide or self-harm. Treating and managing these behaviors can be very challenging and difficult to go through. But we know our kids are worth the time, effort, and love that we give to them to support them through these difficult challenges. I want to thank you so much for taking the time to watch this presentation. Please reach out to our campus counselors, our social workers, or myself if you need any support navigating mental health issues with your child. We are here to support you. On this slide, you will see some resources for how to find a therapist, some books that can help explain self-injury, and some additional websites. Again, I want to thank you for your time and your ability to help your child. We are here to support you in whatever you need. Thank you so much.